This has been a stressful year for everyone, and it's been devastating to mental health, especially for women. Many have been trying to juggle work, homeschooling, home duties, and more. And all of this, along with quarantining, has taken a toll. Perhaps you're suffering or you know someone who is. Well, our sponsor, Blue Cross Blue Shield of Michigan, can help. We are joined by Dr. Christine Gregory, the Director of Behavioral Health. Thank you so much for being with us, Dr. Gregory.
Hi, Toddy. It's a pleasure to be here.
So let's get into this right away. Why is it important to raise awareness about mental health?
Well, it's important for a couple of reasons. The biggest reason would be that there's still a lot of stigma, unfortunately, associated with mental health. And women especially have been struggling. This is Women's Health Month. And so it's important to be aware of the specific difficulties that women might be experiencing due to the pandemic.
So what are some of the signs of someone experiencing a mental health crisis?
There's a lot of signs. One could be an inability to handle tasks, rapid mood swings, agitation, isolating behaviors, harmful isolating behaviors, not self-care isolating behaviors, all the way up to losing touch with reality and paranoia.
Wow, okay. So how can people help someone in their life who might be struggling? What's the best way to approach them?
Right. So the first thing to do would be able to start a conversation with somebody and ask them if they're okay. Encourage professional help if that is needed, if there's a significant acute threat, and take action if there's a threat of harm. So that's a threat of harm to yourself or a threat of harm to somebody else.
Yeah, definitely. People give the signals. We just have to learn how to see them. So
Exactly.
So how can people change their daily routines to help manage their mental health?
So one of the things to do is be in touch with yourself. Meditation is very helpful, as well as journaling, positive affirmations, not saying in a Stuart Smalley kind of way, but to say good things about yourself when you talk to yourself in the morning or after a hard day. Give yourself some positive attention. Outdoor walks, weather's great for that. Always practice self-care, so take care of yourself.
Yeah, that's something that a lot of women struggle with, right? So busy taking care of
Exactly,
everyone else.
Yep. Yeah, women are caregivers, and we are children and, our loved ones. So we're very good at caring for others, but we need to take the time to really practice efficient self-care.
I agree with that. Now, how can people reduce the stigma that prevents people from getting help and support?
Right. So the first thing would be to be educated about mental illness. So mental illness is just like a physical illness. It's just like diabetes. It's not something that you can will yourself to change. And so to be educated about mental health and mental health awareness and become an advocate for that. And really not be afraid of being seen as weird or crazy, asking for help. It's okay to ask for help. It's okay to not be okay from time to time.
Thank you for those words, Dr. Gregory. Sometimes people just need to hear that. It's okay to not be okay. Thank you so much for being with us.
Exactly. Yep. Thank you.
To get the help you may need or help someone you know, visit the Blue Cross Blue Shield of Michigan website, bcbsm.com/mental health.